Thank you so much for spending time with me. This interview is really to get to know you and for you to give us a little bit of insight into the upcoming lecture that you're going to be doing for our community. So, welcome. And do you want to just tell us a little bit about yourself?
Sure, yeah. Thanks so much for inviting me. This is a really unique opportunity. I'm used to speaking to veterinarians, but hand therapists is a first for me. But what we do is actually really quite similar. And I got into veterinary medicine kind of through a back door. It was not what I wanted to be when I was a child. I wanted to be a marine mammal researcher. And I somehow ended up into this field and working with high performance dogs. I worked with military working dogs and then very competitive canine athletes. And they were demanding higher and higher levels of care, not just pharmaceuticals and things like that for injuries. So it led me one step after another into animal chiropractic care, animal acupuncture, and then to herbs, and then eventually to tuning forks. And it was just in an effort to do better and better and better for my patients and be able to treat conditions that nobody else was able to treat. So it just kind of fell into place. But now I consider tuning forks an essential tool I could not work without.
That's such a beautiful story because, we don't always think about dogs being, combat athletes, really.
Mm-hmm.
Yeah.
Yeah, absolutely.
And then you've also done some work with myofascial release and a lot of neurological work. Do you want to tell us a little bit about that?
Sure. Yeah, I got a PhD as well in anatomy and neurobiology. And that was more human-based. I worked with occupational therapists at Colorado State when I was a graduate student. And I've been fascinated with anatomy since I was in high school. And just understanding the parts is part of it, as from a mechanistic point of view, but really understanding how all of it works together and how, especially pain, I've personally dealt with a lot of chronic pain, so pain is kind of a big interest of mine, and getting at all of the different aspects of what could be causing pain. And then that led me to getting myofascial work on myself. And then very quickly I realized, oh, wow, I could use these same techniques on my animal patients. And then started experimenting with that, just manual therapy wise. But my hands were getting really tired of doing that. And animals don't always respond very well to very uncomfortable myofascial release techniques like I could tolerate, but I couldn't ask my animal patients to do that. So tuning forks were a great bridge into how to work with the fascia in a gentler way. But that led me to study a lot. And even in my PhD program, we were just learning about fascia in the early 2000s. It was that white stuff that you scraped off in anatomy lab and nobody really cared about until we realized it had piezoelectric properties and tons of unique cell types and collagen structure and tensegrity and all these cool concepts that just absolutely made sense to me. And I think that's where the tuning forks are working, really, is on the fascia, on the collagen, and being able to open up that up and allow the fascia to function as it should. And I believe that ties into my acupuncture training too. This mysterious thing called qi, I think really ties into fascia as well. And even if you're not certified in acupuncture, then you can use tuning forks on acupuncture points. So all of this weaves together.
Oh, it absolutely does. I've also been looking a lot into acupuncture points using light therapy and learning about the golden channels and how the collagen just is a network that communicates throughout the entire body. And talking about personal experience, it's interesting because I have recently sustained a horrific knee injury, and I have a grade 2 to 3 MCL and PCL tear. And I've been using tuning forks in my practice, and then I thought, oh, I need to experience this with a true healer. And so I found this amazing woman who's 2 kilometers away from me, and I went for my first session. And I think what struck me was that I walked in with extreme pain, inflammation, very limited range of motion, and a poor gait. And she used these enormous tuning forks, which she vibrated on my under the soles of my feet, my hips, my head, but she did so much where I actually fell asleep. So there was so much she did. But I remember waking up to this feeling of fire coming out of this injured knee. And the whole journey was so exquisite. But what I really felt was her energy and how little she touched me. In fact, she hardly touched me. It was all magnetic energy. And yet I got off the bed. I had no swelling. I had far less pain. I had more range of motion and I could walk properly. Can you explain that to me?
Yeah, so I think two things are going on. I think one thing definitely with the body and the long tracts of fascia that you can access through the distal extremities, whether that's the hands or the feet or the head. And all of that, those are in Chinese medicine, the 8 extraordinary vessels. So I think there's probably a physical aspect to that too. But then I don't know how familiar everyone is with the concept of the biofield. So you have an electromagnetic field around you that's generated with your heart at the center of that. And there's an institute in California, the Heart Math Institute has done a lot of research into that as far as the interactions between humans and our biofields, and actually between humans and pets. They did a very small study, almost anecdotal, but they looked at how your heart rate and rhythm and aspects of your heart-generated biofield can affect that of those around you, even pets. So I've definitely personally experienced that with my patients, but anytime I have an animal patient in the room, I have a human with me. So it becomes a conjoined effort in getting everyone into a calm, healing space. So I think neurologically, you need to be in more of a parasympathetic mode in order to heal. And I think tuning forks help both the practitioner and the patient get to that place. But all the magic to me, all the healing magic happens when you're in that parasympathetic mode, that rest and digest and calm sense of space. And I think your nervous system's responding to that with the tuning fork sound. I think the fascia is responding to that. And I think there is this more kind of mysterious aspect that we don't even really have tools to measure the biofield, but there are some tuning fork practitioners that only work with the biofield. So you probably experienced weighted tuning forks, which are like this guy here that have the big weights on the end. But there are unweighted tuning forks that are just used around the body in the biofield. And experienced practitioners can hear a difference if they're taking that tuning fork over an area. Say if we swept that over your knee, you would be able to hear a very slight change in tone in the biofield over that. And again, with experience, and there's a few different training methods out there for that. That you can clear that energy in the biofield, and that's going to actually help the tissue too without ever touching the tissue.
Oh, that's fascinating. And I think exactly that. So the person that engages in this technique really needs to have a calling for the forks, the tuning forks. You need to have a calling. You need to have that belief in the energy. You need to feel energy in your hands with your patients. It's very different to just picking up a pair and using them. There's so much more from a philosophical standpoint. Do you agree?
Absolutely. And it takes time and practice. And when you're beginning any new modality, it's very mechanical and very just strictly by the book. But if you can open your mind and your heart and get into that space of really being able to feel and perceive, and anyone who's been doing manual therapy for a while, you realize that your sense of touch becomes much, much more sensitive. But you can, I guess for me, I kind of turn off my eyes. I could probably do this blind actually. I'm just feeling with my hands and responding to the patient. Again, whether that's a human or an animal, it really doesn't matter. But responding as their tissue responds. And with the tuning forks, I have actually felt very commonly, you can take a very tense tissue feel, and it will, I just say it melts and softens. And that tense tissue feel also is a very dry tissue. So there's not a lot of hydration. Again, if we think about those collagen fibers in the fascia, those are contracted down. We want that opened up so that tissue feels nice and juicy. So you can actually feel the tissue responding and plumping up and feeling better hydrated immediately after a tuning fork. Just a few minutes over tissue with tuning fork. So I think this give and take of being able to feel and respond and use your intuition, which sounds very unscientific, but that's kind of what led me into this and led me deeper and deeper. So I ended up kind of developing, my training was in acutonics, which is kind of a specific tuning fork method. But I took that and kind of adapted it for my own, just based on intuitively working with patients. So I would encourage anyone that starts with tuning forks, it's not so much a regimented, you have to do it this way. That gets you started, but the magic really happens in the practice and in following your intuition.
Yeah. So let's talk about hand injuries, because you are going to be addressing hand injuries in the lecture, and we deal with adherent tendons. We deal with a lot of pain, inflammation, scar tissue. So how does the tuning fork work with the hand?
Right. So especially with scar tissue and adhesions, again, I feel like it's a very, very gentle way to release tissue that's stuck to the bone, release very, very tight tissue without a lot of, or really with no pushing, pulling, tearing, anything like that. It's super gentle. You just let the vibration do the work. And it happens really quickly. Like I said, you can get palpable results in seconds to minutes oftentimes. With chronic injuries, obviously that's going to take a little longer. With edema and swelling, I'll show you techniques for helping move edema out of the tissue. And again, often I will see post-op patients with a lot of edema around joints, mostly knees and elbows and things like that. But you can palpably see the edema come down afterwards. And so, yes, so I think it's very gentle, and the the hands have a lot of nerves in them, obviously. So they can be very, very painful. So I think this is a great technique because it's so gentle. And it would be the only time I have ever had anyone experience pain with it was actually a human I was working with, a friend. And if you have very, very dry joints, so not a lot of hyaluronic acid, not a lot of tissue hydration, the sound travels best through water. So the better hydrated the tissue, the more comfortable and the better results you're going to get. So dry conditions can be difficult to deal with. But it still works, but the better hydration, the better. And then also thinking about, and I think I had asked you this as well, like how far up the arm do you work? Because so many of the things I feel like from my work and with the hands, or the paws, if you will, is that so much of that comes up from the elbow and the shoulder and even the low neck. Yeah. So there's lots of places you can use tuning forks there as well. But even the carpal tunnel, that whole area seems to respond really, really well to tuning forks.
We definitely do. We, in fact, we've all become more holistic as we've understood Thomas Meyer's work and fascia and how everything is connected. We no longer just look at that one extremity. We're all starting to take a big step back and look at our patients and ask them a lot more about previous injuries and scar tissue, and then going to those areas if necessary. And I also find that if I use a tuning fork without first using instrument-assisted soft tissue mobilization, the vibration doesn't last as long. But if I do use an instrument and work on the tissue and then go to the tuning fork, the vibration lasts a bit longer.
Okay. Do you mean the vibration of the tuning fork itself in your hand?
Yes.
Yes. Okay. So what's happening is it's the sound vibration is being dampened by the tissue, and that you've helped, again, probably through hydration of that tissue by releasing some of that, that you are going to have better or longer length of vibration without the dampening effect.
Yeah.
So that dampening is also a clue. If you're not quite sure where the injured tissue is, you can use the weighted tuning forks as well, similar to the unweighted, in that you're not really hearing a difference when you go over an injured area, but you may feel that sound just completely dampen and it all gets sucked away really quickly. And that's usually a clue that you have damaged tissue there. And as that tissue health improves, or again, you can get myofascial release there, then your sound vibration will last longer. So yeah, that's a great observation, and certainly something I see as well. But I usually take that as a clue that you have a lot of damage there. Yeah.
And then tell us a little bit about the tuning forks, because a lot of therapists have emailed me and said, should we buy tuning forks before the session? What should we buy? And, I've looked at the Accutonics website. I mean, they range from $20 on Amazon to up to $300, $400. Can you just shed some light?
Yeah, I wouldn't invest in a whole lot until we talk in the course. But the one that I use more than anything is, they call it the Ohm fork. And there's actually a separate company. So Accutonics was created by two different women, and they kind of went their separate ways. And one person took one frequency, and they call that the Ohm frequency. And there's different octaves as well. So the mid ohm is the most versatile fork. So that's the one that I have here, and it's from Ohm Therapeutics. If you were to buy one fork, I would buy the mid ohm from Ohm Therapeutics. And this one can be paired with any of the other Accutonics frequencies. And there's probably two of the Accutonics frequencies that I use the most. And I can talk about how the different applications for those, but my everyday go-to for 90% of the conditions is just the mid-ohm fork. And so that resonates very well with tissue, with soft tissue, tendons, ligaments, muscles, and bone.
And scarring as well.
For scarring, I actually like a combination. So there is an Accutonics fork that I use with that. And we can go over that in a little more detail. There's two levels. So basically, if you want the strongest, most stagnation breaking combination, is one combination, and that's all based on music theory. So I'll go into that a little bit. It's a deep rabbit hole, but if you get into music theory, there are different pairs of notes that have a quality to them, and they have an emotional quality, but they also have a physical quality. So for breaking up scar tissue, you want something that's really kind of a harsh vibration, and there is a combination that works great for that. There's a gentler combination as well, and depending on the patient and the condition, I'll switch off between those. But the mid-ohm will get you definitely muscle, tendon, and ligament. Again, scar tissue would be a slightly different combination.
Can you share one example of a case you've had with one of your animals that really responded? Just give us a little bit of a story.
Oh, sure. Yeah. Well, speaking of scar tissue, I did have a patient that I was treating for a knee injury. And about mid-thigh on that same leg, this dog had a scar, a pretty big scar with no hair on it. And I had asked the owner what had happened, and it was a reaction to a rabies vaccination about 2 years before. And the hair hadn't grown back, and it was kind of an ugly scar. And so just as I had been working on the knee, I worked up there, and I was using, again, the scar tissue combination of forks. And within about 3 treatments, we started seeing hair growing back. And probably by about the 6th treatment, all of the hair had grown back, and we never saw the scar again. So that was kind of interesting. That wasn't why we were there, but yeah. So I have definitely seen it on scar tissue. the most interesting things, I think, are the ones you can really see. And those would be the post-op, where you have a lot of bruising and edema, and you can just watch the edema come down before your eyes. So that's always very satisfying.
That's incredible. And in the course, you're going to be going quite deep into the physics of it with us, so that we can really get a good understanding.
Yeah, there's definitely some physics terms that you need to know if you're going to be working with sound healing. And then we can go into also some of those combinations. Now, Accutonics will take you very deep into many, many different combinations, like music theory wise. But I'll go into the ones that are most useful and relevant for your therapists. Yeah.
Oh, that's exciting. Well, the course is on the 17th of February, so it's not far away. And we are just so grateful that you will share your knowledge with us, because I do believe that this is something new in our treatment regimes. We are playing, but I do feel that we need more of a deeper understanding, also so we can explain it to our patients. They love the feel. But just one more comment. This lady that I've been seeing, she was also talking about using tuning forks to clear the air. So she said in between patients, just tuning forks. I thought that was as well. Do you want to just comment on that?
Sure. Yeah, everyone's probably familiar with using sage, so burning sage or essential oils or things like that to clear so-called negative energy. But actually, sound can do that too. And whether you have a singing bowl or tuning fork, often we use high frequency tuning forks that are like more than what you would want. You wouldn't usually, we use low frequency tuning forks on the body, but around the body you can use higher frequencies. And definitely for clearing negative energy, a blast of high frequency tuning fork, and we kind of wave it around the area. And if nothing else, it's helping us like recenter ourselves and just kind of give a breath of fresh sound into the area. But yes, we do that in the clinic. Actually, we have singing bowls, Himalayan singing bowls in our rooms as well that we use for that.
Yes, I experienced that in my treatment too. It was absolutely exquisite. So, well, I'm really, excited for this course. I just can't thank you enough. Thank you for giving us some insight. We'll certainly dive much, much deeper when we meet with you. And, I think opening up a whole new world of practitioners to you as well. I think it'll be really good for networking. Are you on LinkedIn? Can people find you on LinkedIn and start connecting with you?
Oh, I should probably refresh that. I was at one time, but it's been a long time.
Okay, because our hub is very much on LinkedIn. But but anyway, thank you so much for your time, and I really, really look forward to the course. And everybody can still sign up. And there is a live, we prefer everybody to attend live. Oh, the other question I've got is people are asking if they should bring tuning forks to the session. Would there be?
If you have one, that would be great, because we're going to go over how to hold it, how to strike it, and some of the techniques that you can even just try on yourself right there. So a little hands-on, sure, that'd be great.
Good. Okay, super. And then, of course, people can buy the recording and they can watch it at another time.